Hi, my name is Tamara Holness. I'm going to be doing a straight cath for Professor Moore's 105 class, and let's begin. Ms. Smith is a 44-year-old woman who has difficulty voiding. Her order states that if she has urine, more than 200 mLs of urine, she's to be straight cath. Did a Doppler and she has 400 mLs of urine. So that is the right to go in straight cath. She has complaints of inability to urinate. So that again gives me the next steps to go in and do a straight cath. So I will begin. So I'm gonna knock on the door. Hi, my name is Tamara. I'm one of the nurses here. Can you give me your name and your date of birth? She tells me her name and date of birth her name is Mary Smith, and her date of birth is 4/27/1976. Okay, Miss Smith, we did a Doppler on you. We see that you have over 400 mLs of urine. So that means that we have to do a straight cath. And you did have complaints of not being able to void. Let me explain to you what the straight cath is. A straight catheterization is we're going to insert a tube into your vaginal area, into your urethra actually. And we're going to drain the urine so that you can be more comfortable. It is a little uncomfortable. You might feel pressure, a little cramping. If it gets really painful, you are to let me know. Are you okay with going forward with this procedure? She verbalized yes. Okay. So since you're okay with going with the procedure, I'm going to let you know the steps. I'm going to have to put the bed down. All right, I'm going to put the bed down. And I'm going to get you comfortable. I need you to spread your legs apart. Okay. And you're going to be exposed. Pull the curtain to give you privacy. So first thing I'm going to do is do hand hygiene. All right. After doing hand hygiene, I'm going to don gloves. Okay. The don gloves now. I'm gonna pull your sheet back so that you're gonna be exposed, okay? But the procedure should take about I would say roughly 5 to 10 minutes, okay? And just let me know whenever you feel uncomfortable so that I know, and I'll try to give you to make you more comfortable, okay? I'm pulling back your drape. Are you okay? She says she's okay. All right, so the first thing I'm gonna do, right, is take a washcloth and we're gonna dip it in soapy water. Okay, and what I'm gonna do now is wipe your area. Wipe once, and then I'm gonna flip. I'm gonna wipe the one closest to me, then I'm gonna flip again, and I'm gonna wipe down the center. Okay? How are you so far? You're good? Okay. So we did that. I'm gonna take off my gloves, throw it in the garbage, and again, get hand hygiene. Alright? So now I'm going to open up the package. Are you feeling okay? She verbalizes she's okay. Okay. Do you have any allergies to medicine? She says, no, she doesn't have any allergies. Do you have any allergies to latex? She says no. So, okay. I'm going to remove that. And I'm going to perform hand hygiene one more time. Again, this is going to be a little pressure. So at this point, I didn't have actual sterile gloves. I just made this into sterile gloves. So at this point now we are practicing the sterile technique. So now I'm going to take my sterile gloves out of the packaging. I'm going to open up my package, the furthest one away, then the sides, and then the one closest to me. Okay, I mean, I know that I'm not supposed to do this, but I didn't know I need some more room. Okay, so now 1 inch border is sterile. Okay, so now what I'm going to do is I'm going to put on my sterile gloves. All right, just practice. Okay. Sterile gloves. Put it on. Using the cuffed, making sure I don't touch outside of the cuff. And then I'm going to grab the inside of this cuff, place it on. Okay, we are officially sterile. At this point, I can touch anything that's inside of here. So the first thing I'm going to do, I'm going to take out the drape. Right? Only make sure to touch only the corners. And this drape will go underneath the patient. Miss Smith, can you lift up your leg to put it? I know that it's supposed to be sterile, but this is kind of hard because I have to touch the box. So this is still sterile. I know this, I hope I don't get any grades and points off, but I have to lift up the box to place it underneath her. But I know, and it's a sterile side down. I mean, the shiny side down. Again, I'm only touching the edges. And we're still sterile. Okay? Alright. So now at this point, my glasses. At this point, going inside the box, and I'm going for my iodine alcohol sticks. I'm opening up the packaging. Exposing the sticks. Okay. And then this is the lube. I'm going to take the lube out. Pour some lube in here in the container. Okay. And then I'm going to put the stray cat in the lube. Okay. So at this point, all right, Miss Smith. So what's going to happen now is I'm going to spread your vaginal area open, right? We clean, and I'm going to clean it. And anytime you're going to feel a little uncomfortable, you're going to feel some pressure. You just let me know how you're feeling if you start feeling uncomfortable. So now I'm taking my non-dominant hand and I'm spreading open her vaginal area. I will be taking the catheter tube. So then what I will be doing now is taking the alcohol swabs that come out with my dominant hand and wiping the furthest away first. Discarding, sorry. Then taking another swab closest and wiping closest to me. Discarding. And then taking the last swab and wiping straight down the center. And discarding. Keeping my hands up above the sterile field. All right, Miss Smith, so we're going to begin. I'm going to insert this tube into your into your urethra to get the urine out, okay? I'm going to move this. All right. Do you have any questions? I'm going to go in slow, okay? She states that's okay. So now I'm going to take the tubing, coil it in my hand, right? That part of the tubing down, and this part in. Right? I'm going to insert the catheter. Okay, so we're going to begin. I'm going to put it in 2 inches at a time. All right, how are you feeling? Feeling okay? I need you to bear down. Okay, like you're gonna do like you're gonna go to the bathroom. Bear down, okay? All right, I'm gonna go in 2 more inches. Okay, and we're gonna drain. Now the urine is coming out. This is gonna be about 2 minutes. Just let me know at any time if you feel any cramping, any discomfort. Just let me know. Okay. All right. How are you feeling? Okay. Great. So we got everything. Miss Smith, I'm just gonna remove it. The catheter. Right? And I'm discarding. Okay? Now I'm gonna remove my hand. Right? And take off my gloves. I want to perform hand hygiene. Then get a fresh pair of gloves. Are you feeling okay, Miss Smith? She is. Okay, so now I'm going to take another washcloth, dip it in soapy water, and I'm going to wipe. Again, outside, turn around, closest to me, turn around, center, wipe. Great. All right, definitely I would discard that. All right, Miss Smith. So that's great. We have the urine. Everything is okay. How are you feeling? Feeling fine. Okay. So I'm just going to cover you back, down. I'm going to pull the bed up. Here's your call light. Do you have any questions? Okay. All right. So she has no questions. She says she's doing well. And I'm like, okay. So now it's just time for me now to remove all of the items. Throw it away. Remove my gloves. Throw that away. Practice hand hygiene. Alright, she has her coil light. Pull the curtain, and that's it. Alright, Miss Smith. There's your call light close to you. If you have any questions, again, let me know. If you're uncomfortable, let me know, and I will do everything I have to make you comfortable. All right? Thank you. Have a good day. Bye.